What if everything you believed about type 2 diabetes being a lifelong, irreversible condition was simply not true? Today, you're about to hear something rare: real patients, real stories, and real results. In today's episode, you will meet two remarkable individuals who did exactly that. They followed the home dedication lifestyle, took ownership of their health, and witnessed what many still believe is impossible. The testimonies are unfiltered, honest, and deeply inspiring. So if you've been told that type 2 diabetes must only progress or that your numbers can never improve, stay with us, because what you're about to hear could change the way you see your own health and your own future. Let's begin.
Welcome to Medilink Talks, yet another podcast. We are going to discuss today diabetes, and we have special guests today. It's not only us, providers, doctors, nurses talking. Today we're going to give the power, the language, the words to our patients. So it is a special podcast because I have two of our patients here. Of them are diabetic. They have type 2 diabetes, and then they've been on treatment. It's quite a special treatment today. That's why they are here. And they've been managing their diabetes naturally. So I have Jagjeevan and Macario. Thank you for coming. And
Appreciate it.
yes, okay, thank you. So why don't I start with Macario?
Yep, sure.
If you can introduce yourself. And I will be having a few questions because we hope that what we'll be sharing here will motivate some other people. And we will even inform and especially motivate people to try what you guys have done.
My name is Macario de la Pena. I'm 50 years old. I started medication when I was 45 years old. And now I'm so happy to say that I reversed my type 2 diabetes.
Great.
Yeah.
Good to hear that.
Yeah.
Since we're still there, I would like as well Jagjeevan to introduce himself. Can you please introduce yourself, Jagjeevan?
Hello, my name is Jagjeevan Gakal, and I'm 30-year-old. And then I have a type 2 diabetes, and then I'm a reverse. Like it was starting, the point was 13, and then right now is 6.5.
Great. That's great. So we're going to come to that.
Yeah.
Okay, that's interesting. So some people who don't know what are these numbers mean,
Yeah.
they will know it as we progress. So I will start with Macario.
Yes.
So please tell me, how were you diagnosed with diabetes?
During 2020, so the first time, as far as I know, September was the first one I take metformin medication. But before that, I was diagnosed with hypertension. My blood pressure is high. And then I feel these symptoms of frequent urination. So after a few months, I went to you and then you checked. You told me to go to have my blood sugar test. And then it was 6.5 pre-diabetes. And then it shoot up to 7.2.
Okay.
Then we decided to take metformin.
Okay.
So that's the start of my, why is this happening when I'm 45 and then why is this?
Right.
Then when I tried to realize that, oh, it's not only myself, it's my ethnicity, where I came from,
Yeah,
and then my family.
I see.
So that's why I decided, okay, I need to take some action. Although it's reality that if you don't take any other action,
Yeah.
you have to accept that you live your life with medication.
Okay. So you were diagnosed, when was that again?
2020,
2020.
September.
Okay.
September is the first time I take metformin.
So you start on metformin.
Yes.
Any other medication that was added on top
Covers her for my blood
for
pressure.
high blood pressure?
Yes.
Yeah.
So
It usually works together. Yeah.
He
Diabetes
gave
and
me
high blood pressure.
2 tablets per day.
Okay. And then for how long did you take metformin?
Took it for a year.
Okay.
But during my time with diabetes, I cut down my soda.
Good. I was going to come to that.
Yes.
Yes. What
No
else have you done?
No soda, no ice cream, no cake,
Okay.
no chocolate bar, which is my favorite. No more.
Yeah.
And then the most important thing, I usually take coffee 3 to 4 times a day, double. And then I cut down. So
Okay.
I tried to drink coffee without sugar.
Uh-huh.
I don't like it.
How hard was that?
No,
Can
it's
you
so
tell us?
hard.
Please take us through.
So when you're used to drinking coffee with sweet, you
Yeah.
like it, enjoy it, right? You like the taste. Without sugar, you're drinking with this.
Exactly.
But I need to cut down sugar. First of all, soda don't. Also, what's hard for me is no alcohol, no beer. When you play golf, after the 18th hole, you go 19 hole.
Mm-hmm.
That's normal for golfer to drink.
Right.
So I don't do that. And then when I started to control my diabetes, then I started to drink coffee with stevia or
Okay.
Splenda.
Okay.
Still no soda. But now since I'm normal, once in a while, and also my golf drinking after playing golf right, is bad. I
Okay.
drink maybe 2 or 3 bottles when I play. So I
Okay.
play 2 to 3 times a week.
Okay.
And despite of that, I'm doing that again. My A1C is still normal. I'm not saying that you have to do that. If you can stop drinking beer, alcohol, or whatever sweet there, don't take it.
Yeah.
It can help more, but
I see.
I don't really.
So you talk about the diet. You do touch on.
Yes,
You do. Have you done anything? Because you haven't talked about that.
diet. Yes, my diet first. Filipinos life is rice, right?
Yeah.
We have this jasmine rice, so we converted from jasmine to basmati, zero sugar. So it's different. You don't feel bloated, and of course, in our diet, part of our culture is when we cook, we added some sugar. There's always a brown sugar added or whatever sweetness there is
In the food.
in the food. But still, I honestly speaking, I don't cut much of my diet. It's just that I'm just taking control of what I drink with sugar, like juice. I don't take those things.
Yeah.
Coke no more. Ice cream no more.
Because it adds up.
A
A little bit of here on the diet, a little of exercise. Like now you're playing golf.
Yeah.
I hope you walk. I mean,
Yeah, you
okay,
I
good.
will. I will.
Yeah,
I will.
good. That's
Yeah.
great. No, thank you. We'll
Yeah.
come back. I would like to hear as well
Yes.
from Jagjeevan. Please give us your experience as well and see what you've done so far.
When I diagnosed by a diabetes, and then before I came to you, and then I see 2 to 3 days, and then my saliva is like so sugary.
Okay.
I can feel like, oh, it's sugar in my mouth. And then I told my wife, and then she said, oh, okay, you should test it.
Yeah.
And then when I tested it, the sugar level was too high.
How high was it?
It was like 13.2.
Yeah.
I was like so stressed out. And then you told me to take metformin, right? The medicine. And I discussed with my wife, and then she said, you shouldn't take medicine. If you take medicine, you're going to be you're going to start eating sugar, or you're going to eat tablet at the night. Oh, that's okay. You can eat sugar now. And then we sit down and then talk about it. And then she said, you should cut the sugar. And then
When was that?
it was last year, 2024 in October when I diagnosed. And then when I came to you, and then first test off, it was like on November 23rd. And then it was 13 point something.
Yeah.
And then I cut the sugar, and then totally no Coke, no Pepsi, nothing, no produced sugar. I used to eat like coffee, steep tea, double, triple sometimes. At work, like you need a sugar at work, right?
Yes.
Because my work is like a lot of walk. I have to
Right.
walk every day, like around 14 to 15,000 steps every day. I cut the sugar. I don't drink. So I started making coffee at home. I bought the coffee, and then I make it myself without sugar. It was like first 2 3 weeks, I was like, I don't want to drink it, right? It's like black coffee is so hard to swallow, right? It's so hard. And then I cut off the sugar, like nothing, no Coke. I just drink a water.
Yes.
Normally I eat like Indian food. We eat roti, dal, sabji, anything. And then we cut the sugar. And then after 1 month, and then you told me to do a retest in December.
Yeah.
And then I did on December, and then it came to 12.4, I think.
Okay.
13 to 12, right?
So it's coming down.
Yeah, it's coming down. And then I continuously do that. And then in between, you told me or you recommend me a diet. The lady, I forgot the name. And then I went there, and then she gave me a diet plan. She said, okay, you have to eat like certain things. You shouldn't be eating. And then I changed my flour, atta. You can say in Punjabi atta, right?
What's
Flour.
that? What is
Sher atta.
What is shirada? Please tell us. Well,
It's
people
like
who are not Punjabi.
we make it chapati
Okay.
from there
Okay.
to eat it. It is a sugar in there, so I change it to a different one,
Okay.
and then it helps.
So you remove shirata where there is sugar.
Yeah,
You start
and
using
I
different-
using fiber one.
Okay.
So
Flour.
the fiber flour,
Good.
because she told me you have to change your diet because my sugar was too high on that time. And then I changed my diet plan. I cut all the sugar, all the Coke, Pepsi, nothing, no produced sugar, no juice, nothing, no orange juice, not even I stopped eating banana because banana has a more sugar, right?
Yes.
I used to drink coffee in the morning and then have my bread with the peanut butter in the morning.
Yeah.
And then after that, because I start work in the morning 5 o'clock.
Right.
So I wake up 4 o'clock and then do my all the routine. And then I have with meal paneer, like a more fiber.
Okay.
Fiber things. So when you eat fiber, then your sugar level doesn't go up.
Yes.
Like right away. If you eat like a sugar and then your levels go up, right?
Yeah, because fibers
Yeah.
digestion goes
Slowly,
This
yeah.
is what we advise people.
Yeah. So you should take like a more fiber if
Right.
you want to cut the sugar, right? So when I cut the sugar, I start losing weight too. And then I lose almost like a 7 to 9 kg on that time, like 3 to 4 months.
Yeah.
And then after 3 months, when we check again, blood and did my blood test on January, and then the sugar level was 9 point something.
Wow.
And
13,
to
12,
yeah,
then
9. And recently I checked then I do the same thing, like I do my diet, everything, and then stop eating like cake, pastries, samosa. I cut everything like oily food, nothing, like go like straight diet.
Yeah.
And then in May it was like 7.4. And then last time I checked it, after 3 months, it was 6.5 right now.
Okay.
Yeah.
That's good.
I'm still doing my process.
Yes.
So my goal is like go to like a 5 or 4 point something. So it will get normal. Then I will see my diet plan, like what can I eat it or not. I should stop eating that.
Cool.
Yeah.
That's great. But you mentioned metformin. You didn't expand much on that. So
No,
you
you prescribed me in the medicine. I got it. I got at the home,
Yeah.
and then I did not touch it.
This happened all the time.
Yeah, I did not even.
The sugar was very high. Yeah, I was quite afraid. I was like, okay, I don't know, because we have to offer all of that. Tell you about the diet, exercise, and then the sugar is so high, offer medications.
Yeah.
So you didn't take medications?
No.
You prepared to go natural way.
Yeah.
How tough was that, or how easy was it?
It wasn't easy for sure, right?
Yeah.
Yeah, you have to, like, your favorite things, you can't eat it. And then my wife, she helped me a lot.
Okay.
So even she did not eat sugar.
Okay.
She
stopped eating
yeah.
sugar.
So
That's so cute.
that's her courage, right?
Mhm.
If she know, like, if she wants something to eat sugar, and then I'm gonna take it too, right? So she cut off all the sugar, and then same here, like I cut off all the sugar.
Good job. This is very important because diabetes is not only it's much more. It's a social component to it. Eating is a social thing. Sport is a social thing. Drinking is a social thing. So if you want to do it, it's good to let your people know.
Yeah.
And many people, unfortunately, they hide it. This is where it becomes difficult. Imagine if you didn't share with your wife,
Yeah.
and then she's still eating all of the things you were eating before,
Yeah.
and you might feel like to eat with her.
Yeah.
Good job. So I'm coming back to Macario. Macario, so tell me, how tough was it for you to transition from what you were doing before and where you are today?
It's so tough because of this diabetes, right?
Yes.
You have to change your lifestyle.
Mm-hmm.
You need to. It's a must for you to do that because if you don't, then diabetes will be there. Right?
Yeah.
And the worst part is if you cannot do it naturally, you'll have to be dependent on medication, which is sometimes in chemical side. I don't want to put that in my body. So
Okay.
it's really your perception in life, your lifestyle,
Mm-hmm.
and if you plan ahead, if you want to live longer, at least you need to control diabetes. I heard so many things, diabetes and blood pressure. I tried to control it, but if you add diabetes on that, it's hard. But
In fact, they work together. We usually talk about ABC. A for A1C, B for blood pressure, and C for cholesterol.
So usually once you start having one, keep looking for the others. It will just matter of time before they come up. But yours, like, you started with high blood pressure,
High blood pressure.
and after that it was diabetes.
Diabetes.
Yes. For Jagjeevan, it was sugar. So if you didn't do anything, the next step was going to do probably high blood pressure,
High blood
Yeah.
pressure.
and then cholesterol.
Yeah.
Yeah.
And then if you don't manage the three together, the next thing is complications, heart attack,
Yeah.
brain attack.
That's really hard. You have to do it. You have to really do it.
Yeah. But what motivated you to stop all of the things that you like, to embrace that? Is there any motivation and special motivation? How did you come to it? Because I have many people really struggling. I have a patient who really is struggling. This guy is in and out of the hospital with infection that never end. Now they're telling him to go, they're going to cut some of his toes.
Oh.
But he can't stop doing things that are bringing the sugar to go up. So that's why I would like to know your motivations motivated you to stop what you were doing before and get where you are. So if I can start with Jagjeevan.
You need courage because my age is 30 right now.
Yeah.
So the main thing is like you don't want to be a die soon, right? If you don't do that,
Yeah.
if you're reliable on medicine and then you're gonna be like, okay, I'm eat sugar right now, and then I'm gonna take tablet and the one tablet, and then it's gonna be normal now. But it will work like for a short time,
Yeah.
but not long time.
Mm-hmm.
So my motivation is I have to live longer. You have to
Okay.
live longer. So I think about myself. I think about my wife. I
Yeah.
think about my family
Yeah.
because I know my family struggle a lot with the sugar problems. So that's why I don't want to do that. So that's my motivation. Like, oh, I don't want to be struggle in my old age.
Yes.
So I don't want to eat the medicine at
If you're lucky to
Yeah.
reach the old age, because if nothing is done, diabetes can shorten your life very
Yes.
quick.
because diabetes is like it will eat you slowly
Yeah.
Yes.
inside. You don't even know that. So that's why you have to be careful with that.
Yeah, true. Personally, I'm quite intrigued to find out what is it that people, even when they know about everything, but they don't practice it. I like what you're saying. You wanted to
Yeah.
live longer and good, abundant life.
Yeah.
That's good. Good motivation.
Yeah.
And Macario yourself, what
Yeah.
motivated you?
It's also the same thing. I want to live longer.
Okay.
But for me, when I watch some TVs and read some article,
Yes.
I don't want those infections that are not healing because of diabetes and cutting some parts of your body because that's the only thing you do because of diabetes.
Mhm.
That I don't like.
Yes.
And also with life change, for me, this is my opinion about it. Those things that's hard for you to control. For me, I think about this as a low grade addiction.
Mm.
Although it's not really bad like other addiction, but
I love that. You
Yeah.
say low grade addiction.
yes, because if you cannot control those things, you addicted to it, you crave for it. If you don't stop it, that low level addiction will be another level, and then now you just rely on medication instead of natural healing.
Right. Right. Mhm.
That's first and foremost for me.
Interesting.
Also,
Yeah.
I have rule that more specifically if I drink beer or what, right?
Yeah.
If you drink, this is just my, I'm not really sure if this, if you drink in a week, in 7 days, if you drink straight 5 days beer
Mhm.
or alcohol, you need to tell yourself to stop drinking for 2 days of alcohol. So I started with diabetes and sugar. If you stop right away, it's gonna might be a drastic effect on you that you don't know, right?
Yeah.
So I did it. Drink beer after 5 days. I stopped 2 days. And then
Yeah, because that is important. I don't catch you because people don't realize that beer is sugar.
Yeah.
In fact,
That's
beer, alcohol give us more calories, which are not good calories, by the way,
Yeah.
than sugar.
Yeah.
The sugar will give you 4, but alcohol gives 7.
10 more.
Yes, so give you more calories than that, and then, but not good quality calories to rely on. and it will boost your sugar.
So I did that. I start stopping myself from the next day, 2 days, the other week, 3 days,
Yeah.
and then I can stop. Those are the ways that you need to do.
So you cut on alcohol as well.
Yeah, the first time I have this diabetes. Because if you don't do that, there'll be more underlying things that's gonna happen to you, right? That
Right.
you don't know.
Good.
So that's why sugar, you need to make sure you have to first accept, oh, I think this is low grade addiction. I cannot stop myself from doing this.
Right.
So when you do that, what's now my action? Since this is low grade, maybe I can stop doing something. Then gradually you help yourself not to force yourself right away, right? So that's for me.
Interesting.
And then now I can control.
That's
Even though
great.
there's so many sweets there, or my favorite chocolate bars there,
Yeah.
most especially Halloween.
Yeah.
There's a lot. I can.
I myself, I'm not diabetic. I've been sugar free for 6, 7 years because I know how bad it can be. I would like to come back on the specific changes. I would like people to hear specific changes that you guys have done so other people can emulate what type of experience you've done. So, Jagjeevan, please, on the diet.
Only the diet.
Yes, on the diet, you talk about the flour you've changed.
Yeah.
Can you add some more?
So mostly I drink like when I wake up. So I drink chia seeds with warm water.
Okay.
I soak it at night and then I drink it in the morning when I
Okay.
wake up. And then I have my cup of coffee without sugar,
Oh, yeah.
only coffee and then a little bit milk.
Okay.
And then with the 2 bread of peanut butter.
Okay.
I choose a peanut butter. There is 0 sugar in there. So I
Okay.
use that one.
Good.
And then after that, I start working 5 o'clock in the morning. And then around 7 o'clock, I have my first meal.
Mm-hmm.
And then it is like a light, we make it with the, and then some assorted vegetables in there,
Okay.
like green pepper, onions, stuff like that.
Okay.
And then I eat it, that one. And then when I have a
There's no-
break, no flour.
Oh.
It's just like vegetables
Okay.
and then a paneer. That's a fiber. There is
Yes.
a source of fiber. You eat more fiber, right? And then after my first break, around 9:30 to 10 o'clock, and then I eat sabji and then
Please
salad.
explain. People who don't know.
Sabji,
What is sabji?
that is an Indian thing. We make it like beans
Okay.
and then
Proteins.
beans and then yellow dal and then mostly more vegetable things.
Okay.
We make it with, it's like Indian spices. We put it in there, but we don't add sugar in our meal, right? So, and with the 2 fiber flour,
Yes, you said you did change the flour before you were using the flour that you were-
different rich in sugar, and then now
you go
we
to
use
the-
to fiber flour now.
Good. That is very important because what he has done, this is in our terms we call, he has gone for food that are low GI, glycemic index, which is just the amount of sugar, how much your sugar will shoot up if you eat or drink something sugary. So what we usually advise is to drop what is high GI, like sugar, once you drink it, or white bread. So you have to go mostly at low GI, where you have more fibers. And then things like that you're talking about, there's more fibers. And then you talk about plant, and you talk about your
Sabji, Indian
which is more of like
beans and
this is
then
protein and-
chickpeas, like a source of more fiber in there.
Right. So I would like to come back to the medication this time around. Jagjeevan told me I prescribed metformin. I thought he was taking it.
Never taking it.
This happens all the time. So, yet you brought your sugar from 13, it was. How much now?
So 6.5 right now.
6.5. Interesting. But can you tell us what was your motivation? Why you didn't want to take medications, or why you didn't take it to start with?
Cause I want to heal naturally. Cause I don't want to be on a medication.
Okay.
Cause once you start medication and then you be like you can say like, oh, you go out party and then when you come back and then check your sugar, oh, is high right now,
Yeah.
and then you eat medication and then, oh, it's okay now. and then you'll be like an easy way out.
Right.
That's the easy way out, right?
Uh-huh.
So you'll be like, oh, if you start eating medication, if I start eating medication,
Yeah.
and then right now I'm going to be like, okay, that's fine. It's okay. I'm going to eat medication at night. I'm going to be, my sugar level is going to be okay now. So it's going to be like a bad habit. You can say that bad habit, right?
I've seen people exactly.
Yeah.
They will go and they eat whatever they want to
Yeah.
eat, and then they check the sugar.
Yeah.
So if the sugar goes up, then they go and take medication.
Yeah.
Even people with type 1 diabetes, when they take insulin, they will go and eat whatever they want, and they increase insulin.
Oh.
And they forget
Yeah.
that that insulin you increase will
And make-
cause other problems as well.
Yeah.
They end up picking up weight.
Yeah.
And weight is accumulation of water in the body,
Yeah.
which is there doing nothing in your body. Interesting. And Macario yourself, you started on metformin, and then what pushed you to stop metformin and just go natural way?
Because of the I've been searching around side effects,
You didn't want side effect.
and I don't want.
Okay.
There's several negative about taking metformin. If you're in diabetes, you don't have any choice. Since I'm still the early age of type 2 and it's not that high, I said, okay, I'll take this, but I'll find a way not to take this anymore.
Interesting. Because for some people, we need to give them medication. Sometimes we add another one, the third one, sometimes the fourth one.
Yeah.
So sometimes even insulin. But most of the time, if they don't respect the ABC we tell them, the diet, the lifestyle, but some can even apply all of that, but they rely on medication. So we are not against medications. Please don't take us wrong.
Yes. I'm not against
Medication,
that.
they do help. But if we can do it in natural ways, imagine you save money, you avoid all of this chemical in you, all the side effects, all the false impression that you are good, because you're checking the numbers.
Yeah.
There's so much to gain by going natural way. That's why we talk about home dedication.
Yeah.
If you can do it by yourself naturally, that's great. Yeah. So now I would like to come to the benefits of what you guys have done. I usually like systematization. Like you go say, okay, on this area, this is what I've gained. I heard that Jagjeevan was talking about the weight already.
Yeah.
So apart from that, what are the other benefits that you've gained by changing your lifestyle and bringing already your sugar from 13 to 6 or 7 now?
6.5.
6.5 now.
Yeah.
Only naturally.
Yeah.
So what else did you gain?
Mostly, I was like more active right now. Like more, before it was like you'd be like, okay, that's it. Somebody's gonna make my meal, and then I eat it, and then rest, watch TV, like something like that, right?
Yeah.
And then right now I do my exercise. That's my best way. I stopped eating exercise
Okay.
before I stopped doing exercise before when I diagnosed, and then I changed my diet plan.
Yeah.
And then I check sugar, like what time it has a high sugar level, and then my dietitian, she told me that you should do more exercise.
Okay.
So and when I have my last meal at the night time, and then you go to bed and then sleep, that time is the most you're gonna be, your body is relaxing, and then your sugar level go up. So that's after that meal, so you should do exercise. So that's my best part for me. I start doing more exercise.
So you do more exercise. Can we say you have more strength? To do more
Strength, yeah.
exercise?
You can say that.
Okay.
And then I motivate myself. So now I start, sometime I make my meal my own. So I start cooking.
Okay.
So I learned more things.
Right.
So I know like which thing I have to eat it, and then I start making myself.
Yeah.
I'll make this one and then eat, and then try how much the sugar levels go up and down, if that food affect me.
Yeah.
And then when you do yourself, you will have courage to do it
Exactly.
naturally, right? When you go on medication, you'll be so lazy.
Right.
You just eat your meal, and then after that medication, and then you go to bed or do your things, right? And then when you know like you have to do naturally, you start doing your own.
Right.
So you have to do like yourself, okay, I'll make this one and then eat it
Yeah.
and then check my sugar level. How is it? And then this food is affecting me or no? So which food is best for me? And then you choose the food and then you make your diet plan yourself.
Mm-hmm.
Plus point for you
Right.
because I'm a vegetarian guy.
I see.
So that's a plus point. One plus point for me, like I don't drink, no alcohol, no beer, nothing. And on the other side, I don't eat meat. So as a vegetarian guy, it's a little bit harder to get a fiber in your body. So you have to choose your food wisely. Oh, this thing I have to eat it. And then after that, you have to check, oh, this thing doesn't affect me. This thing is affecting me. So I should leave that food and then start eating this food. This is better for me. That's a motivation. That's a new version for you. And then you go and do your exercise daily and then go for a walk. And then you start doing those things.
Anything on mental clarity, because they talk about sugar. If you, I'm not diabetic myself, reading the books, they say that when people cut the sugar, there's some mental clarity that happened. Did you guys experience such a thing? Like before you were feeling, some people feeling down, not thinking properly. Did such a thing happen to you?
No, because you have to make your mind. Once you make your mind,
Okay.
like, yeah, I have to do it naturally. Okay, I don't want to take any medication or I want to cut my sugar level. Once you make your mind and then you can do it.
I see.
Yeah.
Okay.
Um, if you go on a stress level, if you see, oh, I have a diabetes, or what should I do now?
Mhm.
And then it make worse. It
Right.
may make more worse. And then mostly I share with my wife and my family, and then they support a lot. And then she support a lot. And then right now, that's why my sugar level is 6.5 right now.
Good job. Good job. Macario, and you, what are the things that you gain so far since you started naturally managing your sugar?
For me, just energy. I'm more energetic.
You feel more energetic.
Yes. And it's more mental,
Mm-hmm.
knowing that you're not diabetes or
Right.
your sugar is normal.
Okay.
So because I know for a fact that I'm 50 years old.
Mhm.
So when you add years to your life,
Yes.
you'll go through these things, whether you like it or not. But if you delay it, then you feel happy, confident. Oh,
Yeah.
I added the years to my life by
Right.
helping myself.
Yeah.
Not having this kind of problems, right?
Yes.
Yeah.
That's great.
The less medication you have for yourself, less problem with your physical, mental, and spiritual aspect in your life,
Mm-hmm.
it will prolong your years, right? If you don't care about your years, then don't bother listening to this podcast. But if you love life,
Yes.
then you have to do it naturally.
Definitely.
That's my take on that.
Definitely. Yeah.
Yeah.
But anyway, now in everything we do, even those who are taking medications, there's no ways you can just do medication by yourself and managing this.
Yeah. Yeah.
You have to combine. And most of the people, once they follow the rules, you tell them the numbers go so fast down. I have many patients calling me, say, Doctor, these are my numbers. Do I have to keep on taking this? And we start removing pills one by one.
Yeah. Yeah.
And then they're fine. They're fine.
Yeah.
But still, we need to keep on checking because you
Mhm.
never know when things can come back. They have to keep on doing the blood test to make sure that everything stays fine.
Mhm.
Yeah, interesting.
Yeah. Yeah. If I might
Interesting.
add though,
Yes. Mhm.
Canada, we're very lucky because some of the medication are free. But if this podcast will reach third world country, Asia, and all those people, you know, it's hard for you to put food on your table,
Mhm.
and then you have to set aside money for your medication.
Right.
So having some natural, medication that you'll take
Yes.
not only help you financially, help your family as well.
Exactly.
So saving money, most especially for those people who are really struggling to, put food on their table. You
Mhm.
extend your life and everybody benefits from it, right? So
Interesting.
yeah, that's the only thing for me that you have to love yourself and find ways to not only help yourself, you'll help your family in a way.
Interesting.
Yeah.
But there's so much to gain from this. You do it naturally, you save money, you save energy, you avoid some side effects from medications, and then it stimulates you to push you to keep on going. So that's great. So now, do you have any advice to people out there who wants to emulate, try and follow what you guys are doing? So what can you tell to those who are out there watching?
For me, I should tell everybody, like, you should not be reliable on a medication. So you have to be more courage yourself, love yourself first. And then if you have diabetes, don't think about, like, okay, it's fine, it's normal. Like, this is not a normal thing. This is dangerous. It will eat you slowly, day by day. And then you need to be loving yourself. And then you put yourself first, and then start doing it naturally. I would say that. And then it is, I know it's not easy, but it's not impossible. It is possible. You can do it.
Yeah,
It's, I did it, and then everybody can do it.
true.
Mm.
I love that. I like that you need to love yourself.
Yeah.
This is a self-love.
Yeah.
If you love yourself, and then you'll be able to love other people.
Yeah.
Imagine if you have a family,
Yeah.
you have a wife,
Yeah.
soon children will be coming up. And then if you don't do this, diabetes can just shorten your life. Yeah. That's great. And Macario, yourself, what can you tell people out there, those who are watching us?
If you don't have diabetes, this is the right time we can hear this to cut down your sugar intake. That's number one. Don't wait for your to be diagnosed as type 2 diabetes before you start these changes.
Yeah.
Here at the beginning, and right now, if you can, try to limit sugar intake in whatever form it is. Just try to limit it. And next is to introduce fiber. It might help you because it helped me. And then I'm showing them my A1C. So I'm showing them the before and after. If the taste is not good, well, it's better than taking chemicals in your body. So why not do it?
True.
That's why I'm sharing this for them to, to enjoy life. Maybe no diabetes.
No stress about the medications. You have to.
No, what you said is true, completely true. Being in Canada, many of these medications are covered by the government, yes. But that doesn't mean that we just need to rely on them. Even though we can get them given free by the government, but still, it is a chemical you put in your body. If you can do it naturally, why not? I'm so happy for this episode. I'm so happy that Macario yourself, you started on medications, but you've been applying natural method
Yeah.
and you found out medication were not helping anymore. They're out. You managed to control your diabetes. Your A1C is normal now.
Yeah.
So happy. You were given medication, never taken it, but you chose to go natural ways. And here we are, controlling your sugar so very well.
Yeah.
But those out there looking at us, we would let you know that this is possible. It is having the diagnosis of diabetes in this life sentence, especially type 2 diabetes, is something that can be controlled naturally. You can do it. My friends here have done it. I have many other patients who are doing it, and then they are leading good and normal lives without medications. Don't get me wrong. Medications, if are needed, we need to take them. But if you can do it naturally and your numbers are coming down, there's a room for you to remove medication and save money, save yourself from receiving all of this chemical into your blood. So many people can do it. You can do it as well. So that's why we would like you to emulate and follow the experience of my friends here. And this podcast, we hope, will help you, especially since we believe that the home where you live should be your first clinic. This is where you can learn how to move, how to cultivate your own vegetables where there's no chemical. And then your kitchen, we want it to be your first pharmacy, because this is where you cook the food, natural food and good food that will help you manage your sugar. Don't forget that food itself is medication. So these are the three pillars of our movement, Home's dedication, that we would like you to start applying today. Thank you very much for watching us. We'll meet in the next episode.